Hi, this is Thalia MK at Health 2.0 Conference Dubai Winter 2022, and I have with me Dr. Aysha Jones, and she is Chief Quality Officer at Taiba Hospital. First of all, thank you for being here with us, and she is also been awarded for outstanding leadership. Congratulations for it. So, Chief Quality Officer, by this name, we know that you are making sure the quality is at 100%. Is that your job?
Yes. Thank you so much for this interview and for the organizers of 2.0 for giving us this wonderful opportunity to actually, interact with a lot of like-minded people. Yes, being a chief quality officer, my main, my daily work is to make sure that hospital standards are met, and we follow the evidence-based medicine, and we follow the Joint Commission international standards are being met in our daily operational activities of taking care of patients. Apart from all of that, not just standards, but giving a compassionate care to patients as well.
Amazing.
Yeah.
So, Taiba Hospital, it have any other branches here, or are they expanding outside? And what is the specialty of the hospital?
Taiba Hospital, currently it's only in Kuwait, okay, and expansion to other Middle East countries, yes, maybe in future. But as of now, we have 100-bed hospital, and we have some new facility renovations happening to have more, extensive OPD centers and stuff like that. But otherwise, yes, we're just in Kuwait. Yeah.
So, being in Kuwait and now being in Middle East, of course, I'm sure you're not just visiting only this conference. You're visiting all the other conferences. What all are you taking as it's internet, marketing, health, every other kind of conferences are there? You are receiving an award, and I think so. It gets a little bit pressurized that being a good leader to advance not only your path in this thing but all the other fields. So, what are you taking from these different kind of ventures to make your hospital more better than it is?
Well, I have only attended the healthcare conference. I didn't get time for the education and the IT, but yes, next time in future I will be attending all those sessions as well. But healthcare, the past 2 days was just exciting with a lot of knowledge, a lot of expertised informations from many like-minded people, and I feel whatever I have gained from here and will help me to actually implement a few new things in my hospital. And plus, I'm happy to see that I've networked with a lot of expertise people, so that in future, even if I need their help, I have that floor to actually contact them and give me their expertise. So yeah, and exactly, yeah.
So, being a doctor, like, what are like, are the Middle Eastern all the hospitals and the culture are similar? Do you feel anything different when it comes to Kuwait and all the other patients around? What are their expectations from your side?
I was just telling about the difference between Kuwait and Dubai and even other countries where they conduct conferences like this. I feel Kuwait is much, it needs a lot of, more path to actually reach this stage, because you don't have enough resources. Educational resources are very minimum there, and people still haven't actually come into the page of, actually, empowering people with a lot of new information. So I was telling them that, like Dubai, I hope one day Kuwait will also conduct conferences like this, where a lot of people will come and actually share their information. Yes, but we are still having baby steps on that point.
Well, at least taking baby step is better than taking no steps. So that's amazing. And I would also like to know, like, for example, you being a doctor and now receiving an honorary award, and for again, congratulations for that. So tell us that what are the changes were expected by you, and you exceeded those expectations when I come to you as a patient. I'm not talking about the hospital, but you as a doctor.
Well, before you say me, yes, I'm a dentist by profession. My background is dentistry, but I have completely moved into the quality and patient safety management side. So I am only leading into standard compliances. But yes, what do we expect to be as a leader? Yes, we have to make sure that the sustainability of improvements. For example, we all start with a big boom. We have different standards being met, but how much more do you sustain all these good things? So that is where I think the challenge is more to have a sustainability over years, to make sure that what you have achieved, you just grow better rather than coming down. And yeah, that's the, and of course patient experience is something which we are really driving into, because we all feel that yes, outcomes are being met, but do the patients actually feel happy entering the hospital, leaving the hospital? So that whole experience journey is what we are trying to improve on.
So, if anybody wants to collaborate with you or with your hospital or wants to take your advice or wants to just reach out to you, how can they do that?
Well, they can of course reach out to me. My name, Dr. Aysha John, Chief Quality Officer, Taiba Hospital, and my email ID, aisha@taibahospital.com. Thank you so much.
Thank you so much for your time. And as she said, at least they're taking baby steps, and some steps are still better than standing still like a statue at a one space. Thank you so much for your time. I hope to see these baby steps grow into huge milestones. And everybody be safe, be healthy, and help each other and be kind. This is Talia MK signing off.